as Kenyans, but much more specifically, the creativity of our parliament. Congratulations, members of parliament. Wacha niwaulize wabunge wetu wakiongozwa na leader of majority wa Senate na National Assembly, tafadhali msimame tuwapigie makofi jameni. Thank you very much. Through you to your colleagues in Parliament, the people of Kenya appreciate the kind of sacrifice and commitment and input you have made. I cannot forget the two speakers for their wisdom. Both these two gentlemen are great leaders. Thank you very much. I know we spoke often on what needed to happen, and they provided guidance together with the clerks of our National Assembly, Njoroge and Nyegenye. I want to say thank you very much, gentlemen. Your contribution is immense, and we don't take it for granted. To our Council of Governors, we want to say we are truly grateful for your partnership. I did commit to our county governments that this administration will not undermine our county governments, and that this administration supports fully county governments in the discharge of their responsibility on health and their mandate on health, and that we are going to work together to make sure that counties succeed, because when counties succeed, Kenya succeeds. And I want to say we congratulate you for your input, as always. And the encouragement that we've gone through this together. And I want to give you my assurance, Chair, my friend Onesimus Muthomi Njuki. I want to give you my assurance that we will not let counties down, especially on the subject of health, because by letting counties down, we will be letting Kenya down, and that we will not do. As you have said correctly, there will be a follow-through with regulations that will underpin some of the specific items of these pieces of legislation. A lot of work has gone into the development of regulations. We will now take them through the processes, making sure that the public have a say, making sure that all the other stakeholders are brought on board, so that we can have the chance to implement universal health coverage this time round and succeed. It is the one thing that we must get right, because Kenyans collectively aspired for quality, affordable, and accessible healthcare system. Not for a short time. We've been here for a very long time. Speaker Wetangula will remember in 2012 with President Kibaki we tried, but we didn't quite get it where we wanted. We tried again in 2017, 2018, but the trials that went in Nyeri, Isiolo, Kisumu, and one more county, there were 4 counties, and Machakos. You remember they failed. The whole thing collapsed. And it was because it needed some thorough thinking. And that is why this time round we decided to create a firmer base based on legislation. And therefore, since independence, significant efforts have been made, but we have never quite gotten where we've always wanted. But that is changing today. We have reached a pivotal moment in our quest to reshape our healthcare delivery system. Today, 4 crucial bills for the implementation of universal healthcare have become law. These laws, together with various policies, strategies, and regulations that will be subsequently implemented, including the community health policy and primary health care and health financing strategies, will lay the firm foundation for the biggest change in our healthcare system ever witnessed. In the Kenya Kwanza Manifesto, we committed to achieving universal health coverage using various instruments. Number 1, we said there must be a fully financed primary health care mechanism comprising preventive, promotive, curative, palliative, and rehabilitative services. We also undertook that there will be integration of ICT into our healthcare ecosystem to enhance telemedicine, health management information systems, mobile health, and especially the portability of health records, as was explained here by Mudomi Njuki, when he said that health records are in all manner of shapes. They are in pieces of paper, exercise books, foolscaps, and all manner of paper. But now, with the laws that we have passed, you just need to identify yourself, and the doctor can pull out your health records, diagnose, know what kind of medicine you've had before, know what kind of condition you've suffered from before, and be able to assist you going forward. This opportunity also, we said, we must ring-fence healthcare funds using facility improvement legislation. And that is the legislation, the FIF legislation we've signed today into law, both for national government hospitals that are referral and even for all the other hospitals down to the village. This is to protect money that we collect from healthcare facilities, not being used to construct pavements or gates or other pieces of infrastructure, but so that there is adequate resources to make sure that there is replenishment of health commodities, there is improvement of health facilities, and that we enhance the quality of delivery of our health systems. We also undertook that we were setting up an emergency medical treatment fund to cater for emergency cancer treatment, referrals, and other chronic ailments. We all know that many Kenyans become destitute because